I have no doubt that Obama will be remembered for his healthcare reform. He promised this reform to his voter in his first electoral campaign. He did this because the situation of the American healthcare system is very peculiar and to a certain extent dramatic. In the United States, when he launched the idea of reforming the system, there were about 50 million Americans without insurance. Healthcare expenditure as a percentage of GDP was about 16–17%, and to give you an idea, in Europe the average is about 10–11%, so a 6 point of GDP difference. And finally, the best indicator we have of population health, that is life expectancy, is significantly lower in the United States than in most of the affluent countries. So with such a situation, Obama thought that reforming the system was essential, and he succeeded where Bill Clinton and his wife failed 10 years earlier. The reform could not adopt the European model. This is mainly because the American Constitution prevents compulsory insurance. So Obama had to play with the existing system, with incentives and penalties to extend coverage to these 50 million people who are uninsured, and promoting primary care and other programs in order to improve Americans' health. We have to wait till the end of the decade to see the final result, the final outcome of this reform, but the preliminary data we have are rather positive. 20 million Americans who were not insured are now insured because of the reform, and the rate of increase of both public and total healthcare expenditure in the United States is lower than in the past. In addition, I want to stress that this reform is also important for the rest of the world, because it promoted the idea of universal coverage by showing that even the last country without universal coverage was really working hard in order to extend the coverage. So we have now many other countries adopting and promoting policies to extend universal coverage.